Hey everyone, welcome to the Zest, the official podcast for Orange Coast Magazine. I'm Chelsea Ranieri, and today's guest has been a colon surgeon for more than 20 years, and she is the surgical director for the IBD program at Hoag's Digestive Health Institute. And you may recognize her from her billboard on Newport Boulevard in Costa Mesa. Thank you so much for being here today, Dr. Elizabeth Raskin.
Thank you, Chelsea. This is a real pleasure. Looking forward to talking to you.
Yeah, so the last time we spoke was back for Orange Coast's health and wellness issue, which was last year. And when I tell you, I didn't stop talking to my friends for like weeks about what I learned from you, which was both equally informative as it was terrifying. So I've been very excited to get to talk with you and ask you the questions that have come up since then.
Well, I'm glad it left an impression, hopefully not a terrifying impression about the GI tract and nutrition. But yeah, I'm looking forward to having this conversation and seeing where it goes.
Definitely. So to start from the beginning of your story, where did you grow up?
Ooh, good question. Well, I was born in Hollywood. In Hollywood, California, and but I grew up in two separate places, and the two separate places are just outside of Washington, D.C. and in Las Vegas. So my parents met when my father was an intern in internal medicine at LA County. Wow. And my mom was a nursing student. And they met, they had me and my brother at that time, and we moved to the East Coast where my father was continuing his training. He had joined the Army and was doing a fellowship in rheumatology, which is a field of medicine that focuses on autoimmune conditions, which is kind of fascinating because that's what a lot of my work is in now. But we lived out on the East Coast where my dad was doing his fellowship. And that was a really wonderful experience being so close to Washington, D.C. And being involved in the activities there. I mean, it's such a hub, right? I mean, it's a historic town, all the monuments and the museums. In fact, my mother worked for the Smithsonian Museum when we were kids. And we would spend a lot of time at her museum on the weekends and the dinosaur exhibit. But fast forward, we then moved to Las Vegas, where my father was one of two rheumatologists for the entire state of Nevada when we moved there in the 1980s. And that's a completely different place to grow up is Las Vegas compared to outside of Washington, D.C. And we now were four, my three brothers and I. Wow. And it was a wild childhood, I've got to say. I mean, you're talking about the City of Lights, right? The 24-hour culture, all kinds of things that, that make you grow up really quickly when you see. But at the same time, there was such a freedom to growing up in Las Vegas. And my parents are uber liberal. And we didn't have a curfew. So we got into all kinds of shenanigans at all hours of the day. And anything from just driving down to the strip in the middle of the night to playing around in the desert, because at that time, there was really only about 300,000 people in Las Vegas.
Whoa.
And I think right now there's like 2 million people that live there. So it was kind of rural when you got outside of the city limits. And you'd go out and throw rocks and look for animals and just, monkey around. But that's where I grew up. And cool. I love both aspects of that childhood.
It's such your parents' story is so cute. It reminds me of Grey's Anatomy.
Yeah, exactly. And it's true. It's true because my father crossed paths with my mother in the hallway, and he said to her, "Where have you been my whole life?"
Oh my God.
I mean, it's like a line out of a movie, right?
Yeah.
So that's what I've known my whole life. But in Grey's Anatomy, to some degree, a lot of that stuff happens. Not really the really weird things that come in the emergency room, but all of the interpersonal dynamics. We used to see those things as medical students.
That's crazy.
Residents. Oh yeah. It's not just Hollywood.
Right.
Put it that way. There's some truth to much of it. So,
that makes me really happy as a fan.
Right. I know. And here's the funny thing. When we were surgical residents, we would clamor around the television because at that time you couldn't stream anything. It was like a regular television. And we would wait on, I think it was Thursday evening, and it was on, and we'd watch the next episode. all together as a group, whoever was on call. And if somebody got paged to the ER or pulled to do something, you did it. But we were fans too, even though we were surgical residents. So
that's so cool.
It was a lot of fun.
Was there a character that you identified with?
Probably not. I mean, I think there's a mixed streamy, dreamy, whatever. I mean, they were all good looking people. Let's put it that way.
Yes, so, very true.
And I was more interested in how wild could they make the episode every time it was on.
So good.
It was fun.
So you went to the University of Oregon and you majored in biology. And at this point, did you know that you wanted to be a colon surgeon?
I knew I wanted to be a physician the vast majority of my life. And, I tell the story of when my father was a fellow in rheumatology, he would practice his talks in our basement in his study. And he would project the carousel slides up onto the wall of this whitewashed, study. And I would sit there cross-legged and watch him give his talks. And I was 4 years old. And I remember just thinking, I want to know what he knows. I want to be part of this secret society that my father is part of and his father before him. And so at a very young age, I had this draw to medicine. And I didn't really know what it all meant because the pictures on the wall, they were of slides and they were stained in these beautiful colors. And so what I knew as a child was that this was abstract art. And it wasn't until later in life that I understand what the meaning of those slides were, in that we were really taking care of people. And I think this is where the influence of both parents came into play. My mother is a nurse, and my mother was fearless in the things that she exposed me to. And so she would take me to her patients' homes when she was caring for them as a home health nurse. And I saw things that perhaps a 10-year-old would not normally see. And I saw the way that she connected with her patients. And it was such a beautiful, touching environment that I said, I want to know what that is as well. I wanted to walk both of those lines between the hyper scientific part of medicine to the human touch aspect. It was so important to blend both of those things. So I'm very fortunate to have parents that represent that in medicine and in life. So
definitely. What intrigued you about the colon?
Well, it's really funny. So I've told this story before that most surgical residents become obsessed with some organ, and the intestines are my favorite. They're my favorite organ, and it's because I see the beauty in them. They are so beautiful to see in real life and to watch, in all their majesty, working and functioning the way that they do. I fell very quickly into that group of people that marveled at the colon and the rectum and the small intestines. And to operate on them was something that was enchanting to me. And I loved the technical aspect of it. I loved getting patients healed so that things work. When your gut doesn't work, you're a miserable, human being. Yeah. And when you can restore function to somebody, it gives you just such a sense of satisfaction, because we take for granted some of these simple things like digestion, evacuation, what have you. They're so critical to our health. And as a surgical resident, I recognize that early on, and I'm so thankful for the mentors that I had that showed me that this was an important and honorable field to be in, even though you get a lot of jokes and comments poked at you as a colorectal specialist. The truth is that you don't know you need someone really good at that until you do. And then you're really hoping that there's somebody who's as passionate about it as I am and my colleagues. So
definitely. And what point did you start working with robotics in surgery, and what's the benefit of using robots in surgery?
Yeah, that's a interesting aspect to my career. So I first heard about robotic surgery in, I want to say it was 2001.
Mhm.
And the robot had just been released. And
Oh, wow.
the interesting part about the main surgical platform that's used in most hospitals around the nation and the world is that it was initially a collaboration between NASA, the US military, and really what they were looking for is a way to help individuals in remote locations and to enable what they call telepresence surgery. So to be able to do surgery on the battlefield or to be able to do surgery on Mars, that's really why the robot was initially designed. And so as they were testing it, people started to say, the physicians that were working with them, we can use that right now. Like in the hospitals we have, we don't need to be in these remote places. And so cardiac and urologic surgeons were some of the first to use a surgical robot. And then later on, colorectal surgeons and gynecologists and general surgeons were. But I heard about it as early as 2001. And then I didn't start to use it until 2010. But it was at a time when I really could say to myself, I see the value to doing surgery through small incisions. It really does help a patient improve more quickly. They have less pain. They stay in the hospital for a shorter period of time. They have better function, faster. And so I became obsessed with minimally invasive surgery and have been so ever since I first did my training in 2010. So fast forward, it's been 14 years and I've operated on, 700 to 800 patients, I would say, with the surgical robot. And I'm very thankful for that element of my current practice.
Yeah. So can most of the surgeries that you perform be done with robotics?
They can. So there are a few reasons why we wouldn't use minimally invasive surgery. And largely it comes down to mostly in patients that either have true emergency operations where you don't have the time for inserting these delicate instruments, or a patient doesn't have the space within the abdomen to be able to insert the instruments. And so my philosophy is you try robotic surgery on almost all patients, and you'd be surprised. The large majority of patients are able to have a successful robotic procedure, and this enables them to go home in 1 to 2 days. This enables them to have almost, invisible scars. Fast forward by a year, many times you can barely even see the incisions we use. And traditional incisions are big. They're the entire abdomen. And it takes a lot for patients to recover from a traditional open incision. And so when it's possible, we certainly use this technology.
That's amazing. And then in 2022, you were recruited to Hoag as the surgical director for the IBD program.
That's right.
What is IBD and what are some warning signs, early warning signs?
So IBD stands for Inflammatory Bowel Disease. And Inflammatory Bowel Disease, the title really is broken up into two major entities. That is Crohn's disease and then ulcerative colitis. So these are autoimmune conditions that affect the intestinal tract. And ulcerative colitis is a condition that exclusively involves the colon and the rectum, so what we term the large intestine. Crohn's disease, on the other hand, is a chronic inflammatory condition that can affect the entire GI tract from the mouth to the anal opening. So this is what many people don't understand about Crohn's disease, is that it's not just, a gut related in the center of your abdomen, abdominal pain condition, but it can be a condition that involves and affects your ability to eat, your ability to digest, your ability to evacuate, and can be very debilitating. And so we are fortunate here in Orange County to have the Hoag Margolis Family Inflammatory Bowel Disease Program, because we have some extremely specialized and talented colleagues that range from our medical GI providers to our nutritionists to our care counselors certainly surgeons, our radiologists, our pathologists that can evaluate a patient at our multidisciplinary care board and help make decisions with that patient about what sort of help do they need, and also to draw on the healing that's available, not necessarily through the hospital or through the clinic, but available to the patient in their own environment and through themselves. So we really try to push the notion that someone can heal themselves. And
yeah.
Healing doesn't just mean that they themselves do everything, but they can use their innate ability to harness their healing capacity. And then we add layers to their care. If somebody needs surgery, if somebody needs dietary counseling, but we like to empower patients. And I think that's something that traditionally has not been as has been the message. It's always been, you need care that comes from an external source.
Right.
Let's empower a patient to heal themselves as best as they can, and then support them in all the ways that we can to get them as healthy as possible.
Yeah, that's incredible. So what is the difference between IBD and IBS? And I don't know if it's just the side of TikTok that I'm on, but IBS is a hot button issue on TikTok. So what are the differences between those two?
So a huge difference, actually. So IBD stands for Inflammatory Bowel Disease. And as we mentioned, these are autoimmune conditions. IBS stands for Irritable Bowel Syndrome. And what Irritable Bowel Syndrome is more of a functional problem where we don't see anatomic changes to the bowel that we do in inflammatory bowel disease. For example, we don't see inflammation and what we call fibrosis when we're laying down scar tissue. We don't see ulceration. So typically when we are looking at a patient with IBS and we're doing a colonoscopy, for example, the colon and the small intestine might look completely normal, but yet patients will have very real and debilitating symptoms that range from diarrhea to constipation to chronic abdominal pain, brain fog, body ache. I mean, the list goes on. And largely, I see IBS as a disruption in the mind-gut connection is really what it is that our gut will send messages to our brain, and our brain sends messages back to our gut. And it affects, first of all, when the brain is sending it to the gut, it affects the way that the bowel contracts, the way that the bowel pushes food through. It'll affect the symptoms that one feels. For example, the bloating, the gassiness can all come from those actions. And then the gut sends messages back up to the brain through neurotransmitters, which are messengers that give us feedback about how we're doing down there. And this can create a sense of anxiety, depression, lack of concentration, poor sleep. And this is a sign that the bacteria of the gut may not be as well balanced as they need to be to maintain our health. And that basically the term we use is microbiome, or the collection of bacteria, viruses, yeast, and archaea that inhabit our gut that help us maintain balance.
So a couple of follow-up questions to that. So what are some other mind-gut connection issues that might come up, like besides IBS? And then also for the microbiome, I will want to dive into that right afterwards.
So regarding the mind-gut connection, some of the things that I've just listed can be rooted in the gut, and one might not even have gut-related symptoms. I'll give you an example. So we think about this with depression and with dementia and Alzheimer's, and sometimes there's a lot of research on autism spectrum or neurodivergence originating in an imbalance in gut bacteria and the microbiome. So it can range from everything like that to the opposite, which Crohn's and colitis are conditions of dysbiosis. And what that means is a dysfunction in the microbiome or a bacterial imbalance. So you can see things that are seemingly obvious, like GI related issues, to things that seem very distant and very not connected, unconnected. And when we delve deeper, we start to realize that those conditions, obesity can be rooted in the microbiome and can affect our, mind-gut connection. So I think that the microbiome is honestly the most important thing to our health. And that's not just a biased colorectal surgeon speaking. That is somebody who it feels so impassioned about this new research and how do we use this and how do we help our patients, find that balance again.
Right. So for the microbiome, can you have your microbiome tested? Like, how do you, like with all these symptoms that might not be related to the gut, how do you eventually get that diagnosed? And
you sure can. Yeah. So there are companies that will do microbiome analysis and can look at the variety of species that live in your gut. It can show you the composition, the heterogeneity of the species. So really, we want great diversity in our gut, and great diversity of the gut comes from eating a very diverse diet. And so companies can test that. And the bigger thing is that they can do the testing, but you have to be able to synthesize it. You have to be able to understand, what does this mean to somebody? Because you don't want to create hysteria and say you've got a bacterial imbalance. And the reality is, no, that's just your own profile. And we need to be able to make the link. So seeing a provider who knows how to analyze this is really important. So that is feasible.
Yeah. Are there any companies that you want to shout out, or no, it's okay if not?
There are a bunch of companies that do the testing. I think that the company that has worked for the longest time in this field is called Genova Diagnostics. Okay, and they have a fabulous program, and they have a wonderful podcast.
Oh, good.
If you're interested in listening to the lab report. And I know the two podcasters well, and I follow them. So check out Genova. There's also a company down in San Diego called Flore. And Flore is a microbiome testing company that also makes custom probiotics. So these are just two companies that I've become familiar with, and am excited to see where our collaborations go as we work on some research together.
Definitely. So speaking of probiotics, do you believe in probiotics, and how can people find ones that actually work?
I mean, probiotics, it's a hot topic, right?
Yeah.
And probiotics are necessary, but they're not necessary to purchase in capsules. Let's put it that way. So probiotics just mean live cultures. So where are we going to get live cultures from if we're not taking caplets or, something that you find at in the pharmacy aisle, or even at a health food store in the refrigerated aisle? Probiotics come from food. And so traditional foods over millennia have been shown to be probiotic in nature, that range everywhere from sauerkraut to sourdough bread to kefir and yogurt, sour cream, kombucha. These are all live culture containing foods that pickles is another one, that are accessible. I make these things at my own home. It takes basically the plant material, salt, and a container. And that's how you make sauerkraut. That's it. So sauerkraut is made from cabbage and salt, and you make a brine by massaging the cabbage and the salt together, and you get it submerged under its brine, and then you give it time. And guess what? The bacteria that live on the plants start to propagate, and you will have a bubbling concoction that is super healthful. And yeah, go ahead.
Oh, no, sorry. Keep going.
No, I was going to say, they're not intangible. You don't have to purchase these things. So these sort of healthy entities are available in your kitchen and at the farmer's market, and you do not need to buy a bottle of lactobacillus or bifidobacterium. You can find that in foods that naturally exist, and it's probably a matter of doing a little research, watching a few videos online to see how they're prepared, but they're very simple. and have become their traditional foods in most cultures around the world.
Are there other foods that you feel like people should get in their diet every single day?
Yes. So a big plug for fiber. So fiber is broken down into really two entities. We refer to insoluble and soluble fiber. So insoluble fiber is fiber that comes from plant material that doesn't get broken down by our enzymes and the acid of our stomach and the secretions of our GI tract, and will create a material that, when it gets to the colon, will be chewed upon by the bacteria that live in our gut. And what happens as a result of that? Well, when the bacteria chew on that fiber, they release short chain fatty acids, as well as other substances that help keep this lining of our GI tract, this mucus lining, keep it healthy. And it acts as a barrier from pathogenic or disease-causing organisms and entities. So fiber is so important for that mind-gut connection, because what we're doing is we're making sure that our gut lining is not permeable to things that are toxic, and it's letting in the things that it needs to. So fiber is super important. Soluble fiber is fiber that is broken down, and when you make something soluble, it is able to be mixed with water, and it's super important for making things soft, right? So as we're having bowel movements, we want something that's well hydrated and brings in the hydration to the GI tract. So fiber is your best friend, unless you have a GI condition where your doctor is recommending that you don't take in excess fiber. And so once again, a reason to see a subspecialist who can help guide you in the right foods to be eating for the conditions that you have.
Definitely. And are there any foods that we should, besides the obvious like junk food, candy, any foods that we would be surprised to know that we should stay away from? Like I've seen things that are like beans are inflammatory and peanuts are inflammatory, but are they, I don't know, really?
Yeah. So here's the thing. I'm a big proponent of not villainizing foods. Yeah. I really don't like to establish what is good and what is bad. It's just like talking about good and bad people. That isn't true, because for example, there are foods that might be the only thing available to somebody, and that's what they have to eat because they don't have the luxury of a farmer's market. They live in a food desert. And so usually what I refer to is you want to eat things in certain quantities, right? So if you have starches and a lot of high carbohydrate containing, maybe even refined processed foods, and that's what you have available, you want to try to have a ratio. You want to not make that the sole thing that you're eating. But if I had to pick a perfect diet for the vast majority of patients, it's going to be the Mediterranean diet, where we're bringing in healthy fiber, largely plant-focused diet, that healthy fiber, variety of foods that are lots of shades of colors, which tell you that you're getting in phytonutrients and nutritious components in that colorful array of food. Healthy fats are in the Mediterranean diet. Olive oil, olives are really big in that diet, seeds and nuts, and then lean protein sources. So a lot of fish. We make recommendations about having 3 servings of fatty fish a week because it provides omega-3s that are so important for good body functioning and brain function. And, interestingly, if you've ever seen that TV show about the Blue Zones, they go into, on Netflix, they talk about the Mediterranean diet in great detail. And one of the things is that they're showing people eating this food, and then they're having wine in moderation. And interestingly, wine is a fermented food, right? So once again, we're going back to this whole notion of probiotics in the foods that we're eating. And then fiber is really a prebiotic. So it's the food that our probiotics are feeding on. That's the way to see it.
Interesting. And are there any, like, as I mentioned, the villainizing of like certain things that they call inflammatory. Yeah. Are there any trends on Instagram or TikTok that you're seeing where you're just like, I really hope this stops, about like misleading information about the gut or food?
There's lots of misleading information on social media, and there's a lot of good information on social media. And I would say one of the things that I would love to get dispelled is this notion that seeds and nuts and popcorn cause a condition called diverticulitis.
Yes, I've seen that.
People will come in and they'll tell me, I've been picking all the seeds off the strawberries and I haven't had popcorn in 20 years because my doctor said I was going to get diverticulitis. Well, the truth is that, first of all, they don't cause diverticulitis. And then second of all, those things can be preventative of diverticulitis because they're high in fiber. And in many nuts are high in your omega-3s and alpha-linoleic acids and things like that. And so not only are they not causing harm, they'd actually be good to put in your diet. There are times when one may not want to eat a large amount of seeds and nuts. For example, if you're having a flare of a condition, and then we really do recommend that is minimized. But otherwise, those are very healthful foods. So I would say that is a trend that I would love to dispel. I would say that another thing is we should be using our instincts about food. And you should eat, I would say, intuitively, right? Okay. You can understand the ebbs and flows of your own body, and you know what foods are giving you good digestion and good evacuation, and what sustains your energy, and what foods are fulfilling, but they don't cause bloat and sluggishness and brain fog. You know those things for yourself. And there are plenty of people that can tolerate such things as dairy and gluten and beans and lentils and what have you. And those can have a lot. Yeah, there's a lot of people who can tolerate that, and it's very helpful when they can. But if you're not one of those individuals and you do have challenges with those foods, you don't have to have a diagnosed allergy. And, people say, do you have celiac disease?
Yeah.
Do you have the diagnosis? Well, you don't have to have the diagnosis in a lab report. You know what you're sensitive to. And so I like to empower patients to say, this is what I have a sensitivity to. I know I don't have the testing that supports that, but trust me on this. This is what causes these symptoms for me. And I believe them, because there are times in patients' lives where they can tolerate beans and times they cannot. Yeah. And some people get over that, and then it becomes a good source of protein for them down the road. Other people do not. So like I said about the villainizing on social media, I don't like broad sweeping statements about food as being good or bad, but it's really about understanding ourselves and what's good for us and what may not work for other people, but it's very personalized.
Definitely. And you mentioned being lactose intolerant. Is Lactaid great or is it bad? I use it.
I can't have dairy in any way, shape, or form because I have a true allergy to dairy.
Oh,
so
really?
I haven't had it in about 30 years.
Oh,
so
wow.
For people that have a lactose intolerance, I think they're able to take Lactaid and have no significant issues.
Okay, great.
But there are a lot of milk alternatives that are wonderful that can provide a lot of healthful benefits. I will say that when you don't take in a lot of dairy, you do need to be mindful about things like calcium and vitamin D, and you need to make sure that you're getting other sources that historically and traditionally are gotten from dairy products. But I haven't had dairy products in 30 years, and I can't say that I even miss it, because now you have so many alternative options for milks and yogurts and for ice creams and cheeses that you can eat that are all plant-based.
Definitely. All right. Now to get to what I mentioned before, that is a little bit of a scary topic. So colon cancer is what you and I had talked about last year. And you had mentioned that it's starting to affect people in their 30s. So what are some signs that people should be looking out for? And also, do you have any theories on why it's happening to people in their 30s?
That's right. So colon cancer has had an uptick, and especially in the millennial generation, is that we're seeing younger and younger people developing colorectal cancer. And it's worrisome because we really don't know one specific reason. And interestingly, it's not because it's necessarily a hereditary or a genetic condition that's passed down. So for our audience, only about 20% of colorectal cancers are hereditary.
Wow.
The vast majority of them are what we call sporadic. So that means that they just happen out of the blue. Now, many of them may have some genetic component that's not a common entity, but the vast majority are what we call sporadic. And so then we have to start thinking, where and why are these cancers developing? And the truth is that they're multifactorial. I believe that colorectal cancer in younger people is due to our environment, the food that we're taking in, our exposure to electromagnetic fields. It's due to radiation. It's due to pollution. And it's a really big wake-up call for us regarding how we care for the planet. So as we pollute our planet and we don't take that seriously, we are going to see that these conditions, colon cancer, but also other diseases, become or start affecting younger people, where we're thinking this is something that only happens as we age. I've taken care of patients in their teenage years with colon cancer that don't have a hereditary. They don't have a hereditary, gene that's the reason for their cancer. Wow. I see many individuals that are in their 30s and in their 40s. And so the most important thing is to look out for signs and symptoms, which I'll get to. But the second thing is the American Cancer Society and many of our national societies have lowered the colorectal cancer screening age to 45. It used to be 50 for many years. And so what does that mean? That means if you are someone with no significant risk factors like family history or personal history of cancer, that you should start your colorectal cancer screening at the age of 45, your first colonoscopy.
Okay.
And if you do have risk factors like family or personal genetic issues, your doctor will tell you how much earlier you need to start your screening, but no later than 45. And it's a test that people have a lot of squeamishness about, but trust me, as someone who both does colonoscopies and has received colonoscopies, you can do it. You can do it, and it is completely worth it so that you can maintain your health and prevent a preventable condition.
Can people in their 30s start doing it, or is like your insurance just won't cover it?
That's the thing. Unless you have significant symptoms, they're not going to, insurance companies typically do not pay for early colonoscopies. And so that becomes a challenge for someone who's just really concerned about their health. But think about the sort of symptoms that one might want to bring to their doctor. Number one, if you're seeing rectal bleeding in your stool, blood in your stool, changes to the color of your stool, don't just pass that off as, oh, it's just hemorrhoids. Hemorrhoids is the only thing that people know of. So they start saying it's got to be hemorrhoids. Well, that may not be the case, although the vast majority of rectal bleeding is from hemorrhoids. You don't want to attribute it to that till you've ruled that out. So see your doctor. Be your own best advocate. Don't accept, oh, you're too young to have X, Y, and Z. And don't also accept the advice of someone who's not willing to examine you. So you need somebody who can look and to do this in a most professional way to reassure you that your symptoms are due to a benign source. And quite frankly, you should be able to fix that bleeding. You should not be living with chronic rectal bleeding or blood in your stools. The other symptoms that someone might feel is a change in their bowel habits. They've always been regular and now they're exceptionally constipated, or they have a lot of diarrhea. Those are things that you should bring to the attention of your provider and get answers from them.
Is there some times where there's no symptoms and you still?
There can be. There really can be. And once again, the reason for screening at the age of 45 is for people that are asymptomatic. So that means that no symptoms whatsoever. What we're doing largely is going in and looking for the precursors to cancer. We're looking for polyps. They're growths that can then differentiate and change into something precancerous or actually cancerous. So when we do screening, it's on individuals that do not have symptoms. So that's the most important thing. And this is true for other screening tests that we do, from pap smears to mammograms, as we in prostate exams. It's screening for something where we may not have a symptom yet, but we're looking for microscopic evidence or hidden evidence that something needs to be evaluated further.
So changes in like your gut health or bowel movements and then blood in your stool, is there any other symptoms that kind of might hint at something?
There are. Some of these are when a condition is becoming more pronounced. So when we see abdominal pain or rectal pain, when we see weight loss, that usually is a sign of something that is already progressing. So I would say the most important thing is to, like I said, be your own advocate. If you have a concerning symptom, don't let somebody dismiss it. Don't let somebody gaslight you and say, you're not feeling that, or you're too young, or you're too healthy to have these conditions. Get the advice of a trusted professional who will reassure you and do the evaluation in the most thorough way, because this is your life that that you have control over. You need to make sure that you speak up and don't be too shy, because these areas can be sensitive areas that a lot of people are not very eager to talk about. Yeah. But when you come to an intestinal doctor, we talk about these things all day long. So there's no shyness on our part, and there's nothing too weird, too gross, too graphic that we can't tolerate. And we welcome those sorts of questions and concerns.
Amazing. Well, in addition to all the incredible work you've been doing in this field, you also spoke at the Hoag Her Summit, which I attended last year. And
you did? Yes, good.
That was amazing. Like, I learned so much. I took my mom with me, and that was just incredible. So, is there anything else in your career that's coming up that you want to shout out or have people look out for?
Gosh. Well, one of the big things that I'm extremely proud of is that I am currently a fellow at the Andrew Weil Center for Integrative Medicine at the University of Arizona. So Andrew Weil is an integrative physician who has pioneered this field. And integrative medicine is, if I had to summarize it, it's basically bringing all of the possible ways to heal somebody together, from traditional allopathic medicine, or what we learn in medical school, to naturopathic, to homeopathic, to traditional Chinese medicine, acupuncture, Ayurvedic medicine, herbalism. And it brings it all together and says that these things collectively bring so much value to a patient's health. And so I'm 1 year into a 2-year fellowship. And I can sit for the boards after this 2-year program to be boarded in integrative medicine. And I'm really proud of that. And the experience that I've had with the Andrew Weil Center has been perhaps the most remarkable education of my entire life. And I've been in a lot of school. From Montessori to college to medical school and all my training. This has been so pivotal, because it is harnessing this knowledge to allow me to become not only a good surgeon or a better surgeon, but to be a healer. And that's something that I never recognized that I had the capacity for. I thought as a surgeon, you're relegated to, making an incision, taking something out, or fixing something. But I think I came to a stage in my career where I felt like something was missing in my repertoire, in my bag of tricks. And really what it was is that healing capacity. And you don't just jump in and start healing somebody else. You start by looking at yourself. And a big part of our training is learning how to heal ourselves and how to come to the appointment with a patient or come to the operating room in our healthiest body and our healthiest mind and spirit. And so that has changed the way that I've practiced in a really remarkable way.
Wow. Congratulations. That's amazing. Well, I could literally talk about gut health all day, but we're coming to the end of our time. And I have 3 final questions for you that we call the Thoughtful 3. So how have you changed your personal health routines after becoming a colorectal surgeon?
I would say I'm constantly changing my my health routines, and I've been a student of nutrition my whole life, having been a vegan in the past for 10 years, and then being on a paleo diet, and I've done all those diets looking for things that would solve some of my own personal experiences and conditions. But I would also say that I have been an athlete my entire life. And, having run my first competitive race at the age of 4 to becoming a chronic marathoner and an ultra marathoner and playing rugby. And now one of the new things that I'm doing, it's really exciting because this is something that I'm doing for my own health, but I've enlisted my children to get in on this, is we are doing a 30-day cold water swimming experiment. And so we are going into water that is 60 degrees or below every day. And we are pushing the boundaries on how long we can stay in the water. And we are finding some of the health benefits of this cold water therapy that has become, I would say it's not necessarily a fad, it's an awakening to the benefits of cryotherapy, of the cold plunges, but also what we're doing is actively swimming in water that's cold for up to 20 minutes. Wow. And there are so many benefits to it that I have seen in a short period of time. And what it is it's like a reset of your body. It's a reset of your autonomic nervous system, what we call the sympathetic and the parasympathetic system, so that you learn to become more comfortable in something that is very uncomfortable. And that is a way to improve your grit, your resiliency. And why I'm so proud of doing this and having my children do it is my eldest is 12 and he is there. He's ready to jump in and he's like, let's go, Mom, let's do this. And what I hope that does is really lights a fire in himself, that these tough things make you a better person. They make you more dynamic. They make challenges in your life surmountable, as opposed to thinking, oh my gosh, I could never get in cold water, or I could never run an ultra marathon. I could never. I'm not, as you can see, I'm not a fan of putting up those barriers. I'm a big fan of testing the limits and also seeing that these things bring a sense of health and healing, and they're at our disposal. They're in our backyards. They're at the beach. They're in a cold water, a lake that you live near. So it's something tangible.
That's a cool challenge. It's successful. I want to try that. What advice did you receive early on in your career that you still follow today?
I've had so many really impactful mentors. I would say one of the best lessons I have learned is from my mother. And my mother never thought anything I ever proposed was crazy or unreachable or undoable. So when I was 12 years old, I told my parents that I wanted to do an ultra bike race. And I was 12 and I had this really terrible 1-speed bike. And my mother let me ride from Las Vegas to Lake Havasu.
Oh my God.
With a bunch of strangers. And I didn't think it was, I thought it was possible, but I needed somebody to believe in me, like my parents, that would sign the waiver that it was okay to do that. And sure enough, I was the last person to finish that 150-mile race, but I didn't drop out. And there were a lot of people that dropped out, and I was 12. And I think that those kind of formative experiences are so invaluable to our own personal growth. So So I would say, to answer your question, some of that best advice was to dream big, to be, as David Bowie would say, be malevolently curious about life. So dream big, think that wild thing out there is something that is possible. Moonshots are incredible for people to have, which is take a chance on something and to not live with fear in your heart, because that's something that I've largely dispelled. Is I'm not afraid of, physical pain. I'm not afraid of, being ostracized by my peers. I'm not afraid of being ridiculed for thinking too wildly. I was brought up in a family that allowed me to be very nonconformist, and I'm thankful for that.
I love that. God, you're so inspiring. And then lastly, what would you tell your younger self knowing what you know now in terms of gut health?
Well, as a younger person, I did struggle with the eating disorder. And so I think that there's a lot I would tell my younger self. I would say that food is your first medicine. And like I was saying about form good relationships with food, as opposed to, like I said, villainizing food. So I would tell my younger self that the most important thing is to use food to nourish your body, is to allow you to function at your most optimal level. I was a runner at a very young age. And so I thought that in order to run, you had to be really lean and you had to be very light. And the truth is that you need food to fuel your body, and you need to build muscle, and you need to build strength and endurance. And that comes from nourishing yourself as opposed to depriving yourself. So when I said that I was a vegan in the past, I was one of these Diet Coke bagel vegans where you ate things that were not real food. Yeah, they didn't have any animal products in them. So it's unfortunate because veganism can be so nourishing to yourself, and it can make you feel incredible, and you can fuel your body for so much dynamic activity and thinking and being. But you can also eat really poorly and think that that's a healthy way to do it. And yeah, so I would tell my younger self to eat for performance, to eat for vitalism, and to really respect your body. Because as young people, I think we get a very distorted sense, and this is especially true on social media, we get a distorted sense of what a healthy body looks like. And we need to really embrace that health comes in many varieties, and our body shapes should be recognized as beautiful, and to see our own bodies as temples that we should worship at, as opposed to finding all the flaws in ourselves. And much like saying that food is good or bad, we shouldn't be saying that about our bodies either.
Yeah, well said. Well, thank you so much for doing this. This is so informative, and I really appreciate it.
Oh, this has been a delight, Chelsea. I'm so thankful that you invited me.
Of course. Thanks again.